Welcome to Medicine Made General, a podcast for patients brought to you by the Johns Hopkins Division of General Internal Medicine. I'm Katie Cavanis Crowley, and I'm here with my co-host, Dr. Beemal Asher.
Thank you, Katie. And we are excited to have our newest faculty member here at Johns Hopkins in the Division of General Internal Medicine, Dr. Christine Kruger, who actually did train in medicine and pediatrics here at Johns Hopkins, and then decided to spend a little time in Connecticut and go to Yale, and was a practicing physician at Yale for a while. But we're glad to have her back. Welcome, Christine.
Thank you so much. I'm incredibly happy to be here. I'm born and raised in Baltimore, so really happy to be back and very excited to be on this podcast today.
Oh, that's great, Christine. Thank you so much. Today we have you on the podcast specifically because as of right now, February 2026, it's cold and flu season. So we thought it would be a good idea to explain to our listeners just some misunderstandings about cold and flu season, just clear up some things. So I will just go ahead and get started with my first question. When people use the term upper respiratory infection, what do they mean? And what symptoms do people typically get?
Great questions. And you can imagine as a primary care doctor, these are questions that I answer a lot, both to my patients and to my family. So upper respiratory infection, that's a term that we use among doctors. And what we mean by that, when we talk about the respiratory system, we're talking about the parts of our body that we use to breathe. So we're talking about our mouth and our throat and our lungs. And an upper respiratory infection, we're talking about an infection in the places that are above our lungs. So that means an infection in your mouth or your throat, or an infection in your nose, or maybe even an infection around your vocal cords or your voice box, or it could be in your sinuses. So any kind of infection that's around the upper part of your face and your throat, and an infection obviously means that you're sick. And sometimes we also call this URI, and this tends to be something that we refer to as the common cold. And most adults are going to have at least a couple colds every year. So I think we're all familiar with the types of symptoms that you have, but usually it's things like runny nose, congestion or stuffiness, sore throat. You might have a cough. You might have like a mild fever, or you might have like body aches, or you might feel tired or even have a headache.
That's great. Yeah, Christine, so a lot of symptoms, right? And so what's really causing it in people? I mean, we hear about viruses and we get some, some immunizations, some vaccines, and then we hear about bacteria. So what are most uh, upper respiratory infections caused by?
This is a great question. Most upper respiratory infections are caused by something called viruses. And if you can remember back to your biology days in school or high school, um, there are viruses that cause infections, and then there are bacteria that cause infections. And those are two very different things. A bacteria is something that's alive, it has a cell wall. We have a lot of medicines or drugs that we use to treat them. And viruses are a little bit different. It's a particle that uses our own body to reproduce and infect us. And we know from many, many studies, a lot of research, and a lot of data that the vast majority of upper respiratory infections or colds are caused by viruses and not bacteria. And when I say the vast majority, I'm talking about numbers like 95% of
Oh,
those
wow.
infections of the upper respiratory tract are caused by viruses.
So when talking about upper respiratory infections, it's a very broad term and covers quite a bit. What would you say are the most common upper respiratory infections?
So, upper respiratory infections are things like a sore throat or pharyngitis. It can be an infection of your sinuses or sinusitis. Um, you might have the flu, you might have a COVID infection. Sometimes you can have an ear infection, or you might have an infection of like your voice box or your vocal cords, and we call that laryngitis. So, those are some different medical terms or medical words that we might use to refer to the different types of common colds.
Yeah, Christine, you just brought up a number of the common viruses. You mentioned COVID, and the flu, is there a way that people can tell what kind of virus they might have? I know RSV, respiratory syncytial virus, is a big one, and then we have the common cold. Is there a way to tell the difference between all these different viruses?
It's so hard to tell the difference. There are a lot of overlapping symptoms, and I think it's very, very difficult to tell the difference between a virus that might be causing a common cold, like a rhinovirus or adenovirus, and some of the other viruses that infect us, like the influenza virus or the COVID virus. A lot of the symptoms overlap, like I say, and then in addition to overlapping symptoms, different people who are different ages and have different immune systems can respond really differently to even the same virus. There are a couple of symptoms that are more common in infections like flu and COVID, and those tend to be like muscle aches, like if you wake up and you feel like you worked out yesterday, but you definitely did not work out yesterday, the day before, and you just have like aches in your muscles, or if you have extreme fatigue, which we call malaise. If you have like extreme fatigue or those types of muscle aches, those are more common with infections like the flu or COVID, but otherwise there really is a lot of overlap. Um, Most of us have had COVID at least once, and it probably felt different each time that we had it. So it is really difficult to tell the difference between the two. But if you feel like you got hit by a truck and you have a lot of muscle aches and you're laid up in bed, that's probably more likely to be the flu or COVID, but it's hard to tell the difference.
So I'm gonna just ask, so is it important to test? Because I know there are some now home tests that people can take. Um, should they do that? Should they be testing themselves?
It's a really good question, and that leads us a little bit into the treatment that we have for different viruses that cause colds. As you probably heard from your doctors and from others, we don't have a lot of good treatments to help speed up the course of the common cold. But there are a couple of viruses that we do have treatment for, and that's mostly we're talking about the flu and COVID. You probably heard of some of the treatments that we have for those infections. So there are some people who can get more sick from an infection from a virus. And for those people, their doctor might choose to treat them for those. So the only way that you can reliably tell the difference between the other viruses that cause the common cold and something like flu or COVID is through a test. And there are some tests at the drugstore. Most of the tests nowadays are just testing for COVID, but there are some tests that test for flu and COVID. And if you're someone who's eligible for getting treatment for those viruses, particularly flu and COVID, it might be a good idea to have some of those tests in the house so that when you get sick, you can figure out if it's COVID or flu so that you can call the doctor and talk about treatment. Um, People who might benefit from treatment are people who have any other underlying medical condition. And by that, I mean like asthma or COPD, or if you're older, like over 65 years old, those people might be eligible for treatment. The important thing to know about treatment for like a COVID or a flu infection is that the treatment only works if you take it right away after you become infected and start having symptoms. So like in the first few days of that infection. So if you are going to have some tests at home and you are going to test, it's important to do that right away.
We've kind of started to touch on treatment, and I would love to learn and understand more about how upper respiratory infections in particular can be treated. And, maybe Beamel, you can relate to this too, but, I think a lot of patients go to doctor or urgent care and they ask for antibiotics. Do those help? First question right there. Do those help?
What a great question, and a question that we get a lot. And this goes back to what I was talking about before. So if you think about what causes a common cold, and as I said before, 95% of the time, those are caused by viruses. And no, an antibiotic will not help you if you have the common cold. If you think about the word antibiotic, biotic means a living thing, and anti is obviously against. So an antibiotic is a medicine that your doctor gives you that helps your body fight against infections caused by living things, which are bacteria. It's sort of an antibacteria medicine. And since we know that the common cold or upper respiratory infections are mostly caused by viruses, giving you an antibiotic is not going to help you with that infection. It's not going to help your body fight that infection. Upper respiratory infections are what we call sort of self-limited, meaning the vast majority of us are going to get better from those infections just over time. Give it 5 to 7 days. Most of us are going to be feeling better without antibiotics. And the big reason why we don't use antibiotics in infections that are caused by viruses is because antibiotics are not benign medications. All medicines have side effects, and antibiotics cause way more side effects when you give them to people for colds than the number of people that they would help. And we've all taken antibiotics before. You've probably had a side effect from those. That can be nausea, vomiting, diarrhea. You can get a bad infection called C. diff of your belly. You can get a yeast infection. It can mess up your microbiome. There are so many side effects from antibiotics. So especially when we know that they're not going to work because your infection is caused by a virus and not a bacteria, it would be a really bad idea to take those for the common cold.
So how should upper respiratory infections be treated? We've kind of like really getting down to it, like what would you tell a patient if they ask, like, okay, like what's my treatment plan looking like?
Yeah, and colds can be really, really terrible things to deal with at home. They can be very bad infections, and there isn't a lot that we can do to make you feel better faster. There isn't a lot that we can do to cure the infection, but there are a lot of things that you can do to make yourself feel better while you are suffering from the cold. And those are probably things that your grandma told you, right? So stay home as much as you can, rest as much as you can, take in fluids, drink that hot tea, make sure you're getting enough water. You might not really feel like eating, and that's okay, but make sure that you're getting enough fluid. And then you can use some of the medicines that you probably have at home in your medicine cabinet, something like acetaminophen, which is also called Tylenol, that's the brand name, or ibuprofen, which is also called Motrin. Those are medications that can really help you feel better when you're fighting off a cold. And if you have any trouble with the dosing of those medications or how often you can take them, you can look at the bottle or you can call your doctor for help. But those medications are good. Things like having a humidifier by your bed at night, or even getting into a steamy shower or standing in the bathroom and there's a steamy shower, that can really help loosen up some of the mucus in your sinuses or your nose. That can make you feel better. There are some other things that you can do. There's some data for taking like a teaspoon of honey. Now, you should not give honey to any children who are less than a year old. That can be dangerous. But honey for anybody else, just straight up teaspoon of honey and just take that. That can really coat your throat and make you feel better. There are a lot of other things like using a nasal spray, like just a saline nasal spray can help rinse out your sinuses. And then there are a couple of cold medications that I do like, that I do recommend to my patients. And I'm going to tell you the names of those. The two ingredients that I tell people to look for in a cold medicine are guaifenesin and dextromethorphan. If you're standing at the drugstore and you're in the cold medicine aisle, there are so many medications that you're looking at. There's, day medications and night medications and all different kinds of medications. The two medications that I like that I recommended are the ones that I said, the guaifenesin and the dextromethorphan. And you can get those in pill form. You can get those in liquid form. They come in all different types of brand names, but some rest, some other good home remedies that I talked about, a mix of acetaminophen and ibuprofen to help you with the pains, and then some of those two medications that I talked about from the cold and flu aisle. That's really the way to help you feel better and get over that cold as quickly as possible.
Great, great. And Christine, when people are, they're writing it out at home, they're listening to your sage advice, but when should somebody actually be concerned that they should see a doctor, or that they probably should get some care Are there symptoms that they should really look out for to say that maybe this is a little bit more than the common cold?
Yeah, that's really important to know. And first, I'm going to talk about people who have a normal immune system. Let's say people between like the ages of 18 and 65 who have a normal immune system. We talked about the symptoms that you might have when you have the common cold, like a runny nose, a sore throat, some stuffiness, and a cough. Those are all normal symptoms of the common cold. If you have some of these other symptoms that I'm going to talk about, that would be a reason to call your doctor or to go seek care. And those are things like trouble breathing. Trouble breathing is not associated with a common cold. That would mean that you have something else going on. So if you are having trouble catching your breath, really any trouble breathing at all, that's a reason to call the doctor. If you have pain in your chest, sometimes we can have a little bit of chest pain from coughing, but if you have any persistent pain in your chest, that could be the sign of a different type of infection, and that's another reason to call your doctor. If you have a high fever that goes on for a few days, I like my patients to call me if they have a high fever for a few days. And then if the cold goes on for a long time, most colds are going to resolve themselves within 5 to 7 days. If you're still feeling terrible, day 7, 8, 9, that might mean that it's turned into a different type of infection. That's another reason to call the doctor. Other people who should let their doctor know is if you have other underlying medical conditions. I mentioned some of these before, but if you have asthma, COPD, heart failure, uncontrolled diabetes, you're more at risk of having a more severe infection. So it might be a good thing to give your doctor a heads up that you're not feeling well so you can keep in close contact just to make sure that you're in good health.
Yeah, I was actually going to ask about that. People with underlying conditions, definitely a group they're more likely to get seriously ill from these infections. Can you think of any other groups that may be more at risk?
Yeah, so we talked about people with underlying medical infections, and then we want to think about people whose immune system is just not working perfectly. So that might be somebody who has cancer, someone who is going through treatment for cancer, or someone who has an autoimmune disease and they're taking a medicine that makes their immune system not perfect, or little babies do not have great immune systems yet, or people who are over 65 years of age. Those are groups of people who are more likely to get seriously ill from the viruses that cause common colds. So that means if you have a cold, even if it's just a stuffy nose, a little sore throat, you want to do everything you can to stay away from those babies in your life. You know, your niece is having a birthday party, you wake up, you're not feeling so great. You should definitely stay home because a baby or someone who's older who's exposed to the same virus that's just causing a common cold in you, that can cause a very serious infection in those people, and they might end up in the hospital for that. So those are some good things to keep in mind when you think about protecting the people who are more likely to get very ill from a cold.
Along those lines, so preventing transmission, right? So here at Hopkins, we are right now under a mask mandate for all our providers because there was a spike in flu in the area. What do you usually tell your patients about wearing masks, especially during the cold and flu season?
Now's the time of year that you might, if you go to the doctor's office or you go to the hospital, you might notice that the providers are wearing masks now. And that's because we know, mostly from the COVID times, we know that masks are very, very good at protecting us from becoming infected from the viruses that cause the common cold. So these viruses spread through coming into contact with your mouth or your nose. So if you're in a very crowded place, and let's just say someone sneezes and you breathe in that material that they've sneezed, that means that you are putting maybe a virus that they have in contact with your own nose and mouth, and you might get sick. So if you wear a mask, that would stop that material from coming into contact with your nose and mouth, and that would stop you from getting sick. Other things that can help, if you just think about the way that viruses spread, is by washing your hands, especially washing your hands before you eat. Because in your normal day, you might touch a lot of things that other people are touching, door handles, sink faucets in the bathroom. Those are things that might be infected with a virus. Viruses can stay on materials for days. They can stay there. And then if you touch that and then touch your mouth, you can become infected. So washing your hands, especially before you eat or after you come in from being in a crowded place, wearing a mask if you're in a crowded place, and those are things that can protect you. And then if you're feeling sick and you're coughing or sneezing and you're within, a week of when you started to get sick, wearing a mask can help protect other people from getting infected from you.
Thank you for providing clarification on that, Christine. And as our time comes to a close here on the podcast, I did just want to ask a general question before we sign off. Is there anything you want to share with our listeners that Bimal and I haven't specifically asked you about?
Yes, there are a few other things that I think are important when you think about cold and flu season. In the beginning of the cold and flu season, September, October, you're going to see a lot of advertisements for the flu vaccine. And what a great way to protect yourself and your family from becoming infected with the flu. Of course, no vaccine is 100%, but vaccines are a really good way to protect yourself against some of the more common viruses that cause cold and flu. Of course, we don't have vaccines against the most common viruses because those viruses tend to change a lot and it's hard to create vaccines against them. But for the viruses that we do have vaccines for, COVID and flu, it's a really good idea to get those vaccinations for you and your family in the beginning of the season each year for the flu virus. Another thing that I think is helpful is just having a primary care doctor. You might not have a primary care doctor, and it's really important, especially in times when you might get sick, to just have someone who you know and who you can trust, who you can call when you're not feeling well, and whose advice you really trust. So I'd recommend that everybody goes out and finds a primary care doctor who you like and trust, who you can ask these questions when you get sick and have them yourself.
Oh, that was great. Thank you so much, Christine.
Thank you so much. Yeah, this has been so helpful. And thank you to our listeners. This has been Medicine Made General from GIM at Johns Hopkins. Thank you for tuning into our podcast. We hope you found this conversation helpful. Until next time, stay informed, stay healthy.